Fire up.
Hello, this is Lisa Gallipo, Personal Health Coordinator at Seabury, and this is Medicare 101. Welcome to Medicare 101. This is meant to be a basic introduction to Medicare. It's going to be an overview of what your options are regarding Medicare. Medicare is quite complicated, so we're not going to go into extreme details here. And everyone should make individual decisions after seeing this information, doing some additional research. It's important that you have all the information before you make your decisions, not make your decision based on what your neighbors are doing, because individual decisions should be based on your individual health, your finances, your age, and how risk averse you are. That comes into play anytime you buy insurance. So your neighbor's situation, your relative situation is always different than yours. So this really has to be an individual decision. So this is just meant to be an overview for you. I did look at other videos online before we proceeded with this today, and just wanted to caution you what you see online. Lots of those videos are made by brokers, by insurance companies. Of course, their information is valid, but they are always trying to sell you something, and it's always good to get some basic information from someone who is not biased, someone who's not trying to sell you anything. This is a great time to be doing this because open enrollment lasts from October 15th through December 7th. That's when Medicare's annual open enrollment is. So it's time for you to make any changes you want to for your Medicare plans, and any changes you make now will go into effect on January 1st. So we're going to start at the beginning. What your first basic choice is. And I find a lot of people have forgotten what their basic choice is when it comes to Medicare. And that's because there's so much advertising going on. And advertising tends to be slanted in one direction towards private plans. So we're going to just start out to remind you the way my parents got Medicare is still available to you. And that's through traditional Medicare. That's your red, white, and blue card. You just got a new one in the mail recently. They took your Social Security number off your Medicare card so that you don't lose your identity with that card. And you got a new card with a string of strange numbers on it. That's your new Medicare card. You should have recently got that in the mail. And you can use that as your primary insurance. And you'll notice on that card, it says Part A, hospitalization, and then it says Part B, medical. And as we review this, we're going to talk about the cost of each of these options. So that could be your traditional Medicare card, and that can be your primary insurance. It generally covers 80% of anything that happens to you inpatient during a hospital stay, and it covers the doctor's charges when you're inpatient. Part B covers your doctors when you're in the hospital. And Part B is generally anything outpatient. And again, your doctor's visits when you're in the hospital. So 80% of that is covered by your traditional Medicare card. Medicare generally costs you nothing. Your Part A costs you nothing. If you worked 40 quarters or 10 years and contributed to Medicare, then that Part A costs you nothing. Part B generally costs, this year in 2019, cost $135 a month, and in Part B is going to go up in 2020 to $144 a month. A lot of people don't even know they're paying for that. It comes directly out of your Social Security check. The only time you see that charge is on an annual basis. Medicare sends you a big fold-out form for tax purposes. It tells you what's been taken out for your Part B. And I should mention that is the base rate for Medicare Part B. People whose income is considerably higher may be paying more than $144 in 2020, but that is the base rate that most people pay for their Part B, and it comes out of your Social Security. And again, this generally pays for about 80% of your inpatient and outpatient and doctor's charges. There are deductibles for Part A and B, and when we're talking about costs, your Part A deductible for 2020 is going to be $1,420. You know what a deductible is. It means that first $1,400 that you have in the hospital is going to be coming out of your pocket if you don't buy a supplement. And your Part B deductible, so anything outpatient or your doctor's visits in the hospital, it's deductible of $197 for the year 2020. Now, most people who decide to stick with this traditional Medicare option, like our parents did, will also buy a supplement because, of course, Medicare covers your 80% and you have 20% out there as a risk if you don't buy a supplement. So most people do buy a supplement, and you'll hear that referred to as a supplement or a Medigap plan. It means the very same thing. And most of our parents walked around with their Medicare card and a Blue Cross Blue Shield supplement card. Of course, there's many companies that sell supplements now, and generally speaking, these cover the other 20% of your Medicare costs, so that all of your costs would be paid for. There are lettered plans that are available. That's how the supplements organize themselves. There's lettered plans A through N, and these are very highly regulated by the federal government. So they're sold by many companies, but if you buy a plan A, B, or C from any company, that plan A is regulated. It will cover the same medical conditions and expenses that you have regardless of who you buy it from, because the federal government tells them what a plan A has to cover, B has to cover, C has to cover, etc. The only reason you'd make a decision between companies is based on the price that they're selling it for. And of course, just like when you go out and buy car insurance, every company has a different price, even for the same coverage. So you want to make your decisions which plan you buy from what company based on the cost. And each plan, of course, has different coverages. So you can buy plans that have comprehensive coverage. And right now, a plan F, as in Frank, is the Cadillac of Medicare supplements. That is the most comprehensive plan. And these plans can cost you anywhere, if you look at the grid, from $60 to $250. And I can show you quickly here. This is a grid of Medicare supplement plans. You can get this off the State of Connecticut Department of Insurance website. It lists all the companies that sell the plans. It has the lettered plans here, and it lists the price of each of those plans from the company. And then in your Medicare and You handbook, which I also recommend as a wonderful resource for Medicare information, they have a nice chart that tells you what all of those plans mean, what the letters mean. So it tells you exactly what a plan A covers, a plan C covers, etc. And as you can see, I mentioned plan F. You'll see a lot of 100% coverages there. It's very comprehensive coverage. I do just want to let people know that plan F for new Medicare enrollees will not be available after this year. To people who turned 65 before 2020, it will still remain available to you, but the federal government, in its vast wisdom, is getting rid of the most comprehensive of plans. They want you to be spending money out of your pocket when you get medical care. So they are emphasizing the plans where you have to spend more money out of your pocket. They say you have more skin in the game that way. But right now, Plan F is the most comprehensive. But this chart, if you choose to go look at it, and your personal health coordinators can talk to you a little bit more about it if you're trying to make decisions between those plans. So again, that would be your supplement and your Medigap, which to some extent, depending on how much coverage you bought, would cover the other 20% of your medical costs, inpatient and outpatient. And then again, if you are deciding to go this traditional way of purchasing your Medicare, the last thing you would need is a Part D plan. That's the plans that came into effect not that long ago under the Bush administration, when a lot of seniors were finding their medication costs were going through the roof. They couldn't afford their medicines. There were stories on the TV. People were choosing between medicines and food. So they created the Part D plans. And what these do, in Connecticut, there's 25 plans sold by 9 private insurance companies, and they have all different kinds of coverage options for you to pay for your medications. Just quickly looking at the plans that are available in Connecticut, they can cost you anywhere from $13 if you're on 2 medications and are both generic for blood pressure and cholesterol. You can probably get a very inexpensive plan for $13 a month. They go all the way up to $128 a month, and you would only want to pick a plan that high if you have a lot of very expensive meds. But again, you would go on Medicare's website to research these plans, medicare.gov. You want to go straight to the source and pick out Part D plans. Again, this is something that you want to do on an individual basis because your medications are different from everyone else's, and all of these companies have a different formulary, a list of meds that they cover. So you want to be sure your individual meds are on the plan that you choose. And again, a wonderful resource to look at these plans. Basically, in the back of your Medicare and You handbook, there is a list of all of the health plans that are sold in the state of Connecticut. Your Medicare and You handbook is sent specifically to Connecticut residents or whatever state you live in. So in the back of the book, it's specific to what plans are available here in Connecticut. The Medicare Advantage plans, which we're going to talk about in a minute, are listed here, and also the Part D plans that are sold in the state of Connecticut are listed here. So that's a great place to look for those. So this is one way that you can still buy Medicare, the traditional way, the way our parents used to buy Medicare. And again, I feel a lot of people receive some misinformation. They think this has gone away. A lot of people don't understand that this traditional option still exists. The reason being is that these are the plans that are heavily advertised. These are called Medicare Advantage plans. And these are, again, during the Bush administration, there was a thought that Medicare expenses were getting out of hand by the federal government and that private insurance companies would manage federal dollars better than the traditional Medicare governmental system did. So they started to allow private insurance companies to sell Medicare plans. If you go this route, you can take your red, white, and blue Medicare card and put it away somewhere. They recommend you don't destroy it or throw it away. Keep it because someday you might want to go back to this option. But your red, white, and blue card is not active if you choose a Medicare Advantage plan. You will get a card from the private insurance company that you buy your Medicare from, and that becomes your Medicare coverage if you make this choice. Now, if you decide to go the way of Medicare Advantage plans, the way these plans work they are what you would refer to as maybe holistic plans, because instead of buying and having 3 different cards to have your Medicare benefit, you buy one plan from one insurance company, and it covers your inpatient, your outpatient services, and all of your medications. So they're holistic plans. It's all one card, one company. The costs of these plans, the premiums, run from anywhere from, you can get a 0 premium plan, which you will see heavily advertised on the TV, and they can go all the way up to $250 a month to buy these plans. These plans do vary, though. When you go and you look at plans, there's 3 kinds of plans that you can purchase. There's the HMOs. Those are those traditional health maintenance organizations. Basically, what those means are that they're very regulated. You have to go to the doctors that are on their preferred list of doctors. You have to go to the hospitals they say to. You have to go to all of the vendors, medical vendors that you use. You have to go to the providers that insurance company works with. And if you want to go to a specialist, you have to get referrals from your primary doctor to your specialist. So the HMOs are very regulated plans. They tend to be the cheapest because of that. The insurance company regulates who's in their plan network, and they keep those costs low. So those are the HMO options. There's the PPO options. They're the preferred provider organizations. And what those are, they give you a little bit more flexibility, so they tend to be a little bit more expensive. But it means they have a preferred list of providers. They want you to go to the preferred list of providers. You can go out of network. It would cost you more money, but it gives you a little bit more flexibility. And then there's the PFFSs. Those are the fee-for-service plans. They're the most expensive type of Medicare Advantage plan you can buy, but there's more flexibility. You can go to doctors that you want to, and again, you might pay various amounts of money to go see other doctors outside their plan. So those are the 3 kinds of plans, and again, they are along a range of $0 to $250 a month. There are some extras that come along with Medicare Advantage plans. It's why the state of Connecticut often calls them Advantage plans, and why the feds call them Advantage plans, because there are some advantages to them. Those are generally dental, vision, and hearing. Traditional Medicare, and when it was created in the 1960s, the federal government wanted it to pay for major medical expenses, and they really didn't think about your teeth, your eyes, or your ears back then. So generally, the Medicare Advantage plans might have some extra benefits for dental, vision, and hearing. They tend to be, I'll generally say, small benefits, and sometimes there's even a fee attached to the cost of your Medicare Advantage plan to cover that kind of expense. And again, lots of variety here. There's 30 plans available in Connecticut in 2020, sold by 7 companies. So that is the basic decision that you have to make when you're looking at Medicare.